Welcome to the final webinar in the Jobskin webinar series for 2025. My name is Rosemary Kendall. I'm the Clinical Advisor for Australia for Jobskin, and this recording is actually a re-recording of the webinar that we offered earlier in November. However, we did have some technical issues, and I just want to acknowledge my colleague Veronica Eichmann, the New Zealand Clinical Advisor, who was fabulous and stepped in, but just highlighting during that webinar that every slide to her was a surprise. So we just thought we might re-record so that we had the whole webinar available to you. The topic you can see today is all things kids, which I did think after we decided on this that it was a bit of a grandiose title. However, we will do our best. So why this webinar? We wanted to highlight a bit the differences between adults and kids, and then to look at the impacts of the differences. For those of you who work with children, hats off to you. It can be really challenging, we know that. So we wanted to provide some measuring and management tips, and we have certainly pulled the resources from incredibly experienced clinicians around Australia and New Zealand. We wanted to highlight the standard Jobskin offerings for kids, which have changed or are at the point of changing. And we just wanted to reference or refer to unique conditions, a couple of unique conditions that affect the paediatric population specifically. We will outline the ready-to-wear garments that Jobskin manufactures for kids, and we just wanted to point you in the direction of some good resources. So let's just think about the key differences between adults and kids. I think oftentimes when people first go into working with children, they assume that children are the same but smaller, but that is not so. There are differences in proportion. Those of you who work in burns would be well aware that the rule of nines used for assessing TBSA in adults is modified for children because of the head size. Also, bellies are proportionately larger as a gross generalisation, but also are prone to fluctuation in size. Bones and cartilage are flexible and immature. So we'll talk about this in a little bit further in the webinar, but that poses particular risks that we need to accommodate. The skin is thinner, more permeable, and children are less able to regulate their temperature easily. And of course, they are more active. So that needs to be considered when measuring, but also needs to be considered in the garment design and the garment that's provided. And of course, they grow. So whereas an adult may get 6 months out of a garment, most paediatric units around the hospitals, around Australia and New Zealand would replace garments every 3 months to allow for growth. They are, of course, less mature emotionally, and so their ability to cope with difficult situations, and certainly in measuring for garments, dealing with pain, and fitting garments, wearing garments needs to be a factor. And of course, there's behavioural and social elements, which we'll touch on a little bit later. So what's the impact of those differences? I've referred a little bit to it. But with different body proportion, we do have to think a little bit differently about how a garment anchors and how it fits. And that's proportion and activity. So we use the same rule of thumb where we are trying to anchor at a narrower point, never anchor at the widest point of a torso or a limb. But small children are often straighter or maybe a bit bulbous around their middle, where we can rely on waists in adults. So that has to be considered. Bones are highly susceptible to pressure, and that means, if I use a face mask as an example, if you have the zip closure or the Velcro closure in the same place all the time, you can actually get indentation in the skull. So I have seen a situation where that occurred, and we resolved that by when we provided 2 garments, one had a central closure, the other had 2 closures, one sort of on the sides at the back of the head, so that there's not this sustained pressure being provided. As we mentioned, the ability to regulate temperature can reduce tolerance to garments with the heat, but also the changes in skin can impact healing and scarring, but that's sort of a wider topic, but something that we need to bear in mind. Activity definitely impacts anchorage and fit. For example, an adult, unless their work specifically requires it, would not be reaching overhead frequently and therefore pulling a vest up so it rides up, whereas children, when they're active and they're playing in playgrounds, they'll often have their arms overhead. Growth, I mentioned that impacts the fit and the frequent replacement. And I might just mention, just as an aside, when you are measuring for children, because they grow quickly, but also they can gain weight quickly after discharge. If you're measuring when a child has been in hospital, it's a good idea to measure looser and allow for additional length, like an extra centimetre or 1.5 centimetres, say on arm sleeves and leg lengths, because when children go home, they put on weight quickly and their garment doesn't fit. Even at a first fit, it doesn't fit. And to lengthen or expand a garment requires a complete remake, which is obviously a costly exercise. Emotional maturity, we've referred to that. It's harder for a child to tolerate and even understand why they need to wear a pressure garment. And there's wider issues around behaviour and social issues, which we'll touch on, as I had said previously, just a little bit further along in the webinar. So what are some of the specific considerations we need to accommodate for children? Well, obviously, as we're kind of getting a theme here, we're protecting bony growth and development. Smaller circumferences require reduced compression. There's a risk of edema, but also risk of really high levels of discomfort. And we do adjust the reduction factors when the garments are being made in order to protect smaller circumferences. We obviously want to protect bony prominences, just as we would with adults, but probably there is a higher percentage where the bones are more prominent. Of course, we need to consider donning and doffing, and that means a garment being readily put on by a parent or carer, but also not so easy to remove that a child frequently removes it when it needs to be being left on. We need to consider their functional movement patterns. This is a great example here, this image of an Adonis vest. For example, if this child had needed pressure over the shoulder, you can't readily achieve good compression over the shoulder through an extended arm sleeve. It's just not possible. And a vest can be really irritable to wear. To get good anchorage, you're often wearing a vest sort of down below the waist. But then, of course, every time a child lifts their arm over their head, the vest slides up, the child pulls it down or maybe doesn't, and progressively there's less compression over the shoulder. This Adonis top here allows, by having this gap between the anchorage and then the actual area of compression at the top, means that a child can lift their hands overhead and there's minimal movement on the base of the vest, which is the anchorage point. So that's one example of how we take functional movement patterns into account. Fluctuating abdominal circumferences. I hope I'm not crediting the wrong person. I think it's Alex Cotton, one of the therapists in New Zealand, who, when she is providing vests for children where they do have fluctuating abdominal circumferences, she has power net in the top part of the vest and Conform-Tex, a softer and more forgiving fabric, in the lower part, so that it accommodates that without causing discomfort. And obviously for children, toileting and hygiene is a little bit more of a challenge. Young children are learning to wipe their bottoms and to wee in a way that doesn't get all over their clothes. So there are alternative pubis openings. The image on the right shows the pediatric pubis opening, which is wider at the back, and so it's less likely to get soiled. And also we provide nappy straps as anchorage for vests for young children. And I mean, that's really more to do with anchorage, but when it's also helpful for children in nappies. And if you are providing a garment for a child wearing a nappy, the bulk of the nappy has to be taken into account when you're measuring. And the other consideration is compliance. So engaging children in the process, maybe their choice of colours, or maybe you need to take into account school requirements for colours. I have been aware of one child who was not permitted to wear their garment to school because it wasn't in line with school colours. So we just need to, like in fact any person, child or adult, we need to make sure that the person wearing the garment is involved in the process, and that we make it as easy as possible for them to adhere with what their treatment recommends. Okay, just a couple of other specific considerations, and these are some of the wider social issues. I've had a number of therapists say that with the change in parenting style to a gentler parenting approach, it is making it more difficult for parents to enforce, for want of a better word, their child wearing their garment regularly. So I think for those of us working with children, it's helpful to do some really clear thinking about the best ways to educate parents and to equip them with words and approaches that can encourage a child to continue to wear their garment. The other thing is, the other sort of issue is that obviously when an era where consent is very much a issue presently, and also another change in parenting styles where, like, an adult or a parent will ask their child if they can give them a cuddle. It's not an assumed privilege or right, and of course that then raises the issue about consent to again, for want of a better word, enforce a regular wear of garments. So same again, it's worth considering, sort of preempting those sorts of concerns that a parent might have. Now, a few little extras, and this is helpful for engaging children in the process. Jobskin has a huge range of motifs that can be used to that can be stitched onto a child's garment, which sort of is a helpful way to keep them engaged and motivated. We also offer rainbow or unicorn stitching, where 2 threads are used, and it's remarkable actually. There's only 2 threads used, but it looks like there's more colours than that when it stitches out, so it's a nice little highlight feature. Jobskin accommodates specific requests, and I've got a couple of images coming up where you can see how that has happened, and it's been a really good motivating thing for a child having to wear garments. Here's the first one. This little girl, I mean, I've got to say, what a cute little poppet, but also look at how chuffed she is to be wearing her face mask and her vest with the little skirt that Jobskin provided at the therapist's request. And I do apologise because I can't remember that little poppet's name. I do remember this little poppet's name, however. This is Rain, and I just want to read you an email that Jobskin received from the therapist Penny at Perth Children's Hospital. She said, "Yes, it was so fun and therapeutic to support Rain in this way. We actually did the measuring of Luciana the Cabbage Patch doll with Rain while she was in hospital recovering, as she was quite traumatised. We knew the risk that she would reject the garments. It had the opposite effect. She won't take them off, haha, a definite win. I'm so impressed with how supportive Jobskin has been to our Rain and Luciana project, so absolutely so generous." But again, another pleased little girl, and who's got her little doll on board with her garment regime. So let's go into some of the more practical things. First of all, when you're measuring a child, they are wriggly, obviously. There is a specific pediatric tape. Many of you would be aware of that, but it's a dual purpose. So generally for adults, we have one tape for the upper limb, we have two for the lower limb, full length and then below knee. And each of those has got one solid tape, which is always the first tape to be secured. But for the pediatric one, we've got dual purpose. Obviously, you select whether you're working with the upper limb or the lower limb, which is your anchor tape. You're either using the one around the elbow or the one around the heel. But these tapes do accommodate both. So the other thing I need to add is that the tapes are a little bit thinner, more like the width of the circumferential tape for the upper limb, as opposed to the lower limbs, which are a bit wider and more robust. They are marked distal to proximal, like all our paper tapes. And so a few little hints when you're using the tapes. Reinforce the spine of the measuring tape. That's I can't go back, I'm afraid, but that's the spine is the long length off which the circumferential tapes come. Reinforce it with sticky tape before you put it on the child, because paper tapes can tear, but putting sticky tape on just means that it won't tear. It might tear a little bit right on the edges, but the tape will remain intact. Use the Jobskin card for measuring linear lengths, particularly fingers, rather than trying to do anything with a tape measure. If you are absolutely desperate and you have no toys or distractions where you are measuring, use a spare tape for a child to play with. There's plenty of distraction and pleasure in that. And then from a more practical point of view, let us do the finger lengths for you. If you trace the hand onto the hand trace form, just mark where you would like the fingers to end, and we can do that measuring for you. As long as you've printed the hand trace at the correct size, then we can measure it when we receive it in the factory. And if that is too tricky to actually physically take a hand trace, then photocopy their hands or their feet and we can take the measurements off that. If you are doing the hand trace, make sure that you dot the base of the web space before you take the trace, because that helps us get a really good base for the base for taking the measurements. Now, a few hints from an expert. So this is Claire Toos assisted us with a workshop that we did at an ANZBAR ASM in Tassie, and Claire gave us quite a few hints, which I'm again sharing. So again, thank you, Claire. Her first tip is to develop a priority order for measures for any given garment. For example, for the glove, take the circumferences of the affected digits, the palm circumference and the hand outline, also using a photocopier when you need to, then the rest, and then the unaffected digits. Because if the unaffected digits are a little bit too loose, that doesn't matter. It matters where in the affected digits. For a vest, prioritise the chest, the axilla and the neck circumferences, then the lengths, then the waist, abdomen and the end of support, and a nappy strap. So that's almost, well, it's definitely in a priority order, but they're the most critical measurements. Face mask, the circumference under the chin angle and above the eyebrow first. They are the two main circumferential measures for the garment. So everything else kind of, they're details beyond that. That provides the basic shape and size for the garment, and the rest are details. Important details, but if we get the fit right first, then we can work from there. And cross checks and quick tricks are your best friend, because it's a way to confirm the accuracy of your measures, particularly when you've got a wriggly body. Again, these tips are from Claire. Thanks, Claire. So the axilla circumference in a child is usually roughly the same as the neck circumference. Vest lengths to the end of support, it's a contour front measure and a linear back measure. They really need to be within about 3 centimetres of each other. With pants measures, you can cross-check your heights by subtracting the gluteal fold to the floor from the end of support, like from the waist to the floor, and you just tally them up. And tallying with the gluteal fold again to the waist. So the maths should work. It's basically A and B together cumulatively makes C. With open face masks, measure the tragus of the ear to the part of the cheek where you want the face make to finish, just to ensure the opening of the face is not too wide or too narrow. And again, in case you haven't heard it, this is the 3rd time we're mentioning photocopy little hands or feet, because that's a quick trick that is really your best friend. Now, a few fitting hints. So face masks. Jobskin strongly recommends that we don't supply a face mask with the ear holes already cut, because it's like the measurement for, like, you could have a measurement for a very chubby faced child or a more angular faced child that are exactly the same, but the proportion around the circumference is different. So it's better to fit, and then all you need to do is you mark the top and the bottom of the anchor points of the ear, the pinner, to the head. You don't draw an ear around it. That's if you're choosing to cut the ear holes. And for open face masks, as it's mentioned on the previous slide, add the tragus to edge of garment measure, and especially when you've got a child with very chubby cheeks. Shoulders on vests, make sure that you measure with the recommended method. This is the recommended measure for taking the shoulder or axilla measures is that you have hands on hips, you pass the tape from the top of the shoulder around under through the axilla, back over the top, and then you ask the child or adult, the individual, to lower their arm straight. In an adult, it eases about 1.5 centimetres, or you allow the tape to slide, it eases about 1.5 centimetres. I'm not quite sure what an average would be for a child, but it is significant. When you put a garment on, if the zips are buckling, just make sure that the garment is not too long, because if it is too long, while the fabric can kind of be adjusted to sit at a comfortable length, zips cannot, and that might be causing buckling. So check the measure on the inside leg or arm, and you can shorten it if necessary. Pubis openings. When you have a pubis opening measure, make sure you're measuring over a nappy if you are going to be using a nappy. And lining a pubis opening helps to prevent it digging in. And there's a range of open pubis styles to ensure good compression, adequate hygiene and comfort. So when you are fitting, it is really important that with vests or with pants that you pull, like with pants, that you pull them right up so that the garment is sitting correctly in the groin, and that will help you really determine whether it is a comfort or a fit issue around, say, an open pubis. In the with a vest, make sure that when you pull it on that the axilla lines up, that the axilla seaming is sitting in or over the axilla, and make sure that the vest itself, that the back is lifted up, that it's not dragging down the back. So just make sure, like you put a shirt on and you adjust it, just make sure that the garment is actually sitting correctly before you check the fit. Now, if garments bunch in between soft tissue rolls, or if circumferences are significantly smaller at elbows, wrists or knees or ankles, there is a risk of tourniquet and distal swelling. So monitor that closely, but also do consider that at the time that you're measuring. So sculpt the garments with your measurements, increase the measures at wrists and ankles, as I say, perhaps include feet in lowerling garments so it can ride over narrow ankles. Consider an anterior ankle insert, which can be really helpful. And as I say, monitor closely and ask the parents to do the same. Now, what are the Jobskin standard offerings for children? So if we used to have a nappy strap that would be free under the age of 2, that is now free for a child of regardless of age. We just don't charge for a nappy strap. A seamless sole is provided as standard now for all children under the age of 10, again at no additional cost. It used to be under the age of 7. There is a blanket paediatric discount for all children under the age of 10, and all children under the age of 10 will get a free triangular zip cover on arm sleeves to protect them from basically taking their garments off. All right, now just a couple of unique conditions to touch on. Vascular anomalies most occur when in children, and obviously they can still be a considerable issue in adulthood, but not all vascular anomalies continue into adulthood. We did a big workshop on this at the ALA a couple of years ago, and we have that information available for you if you're working in that clinical area. But proportionately it's a higher occurrence in children, and vascular anomalies are very complex to garment, particularly when there's fluctuating volumes. If you are measuring a vascular anomaly for the first time, we'd really encourage you to call Veronica or myself and arrange a shared review via telehealth so that we can help you, or we're happy to talk to you prior just to highlight some of the issues. And then a particularly unique condition to children is the omphalocele, which is a birth defect where abdominal organs protrude through a central opening in the abdominal wall, but they're covered by a thin sac. So Jobskin provides a garment that's called an omphalocele band. We most commonly make it in Conformtex, which is just this beautiful general conforming soft fabric. And we now have a specialty form for that, so you can confidently take measures. That's now up on our website, but it is a new form, as I say. Now, paediatric ready-to-wear garments. These are really thin on the ground. There are very few manufacturers that produce ready-to-wear garments for paediatrics because of the fast growth, the range in sizes, multiple reasons, and a smaller market. But we really wanted to try and address that kind of gap, and what we wanted was a garment that would be easy to adjust, that you could wear like a vest front to back, that was easy to use, necklines that you could customize yourself, lengths that you could customize. So our vision, or what we're really trying to provide, is a way to provide a cost-effective garment for early compression, rather than waiting till scarring is robust and therefore able to tolerate the compression. A Conformtex ready-to-wear garment can be put on very early. It can be used to assist with dressing retention for slow healing wounds while still providing therapeutic compression over scars. It's a great trial for whether a child is going to adhere to wearing them, and particularly with kids that you think are potential loss to follow-up. So it's a kind of a low-risk cost to incur for a clinic or a hospital. Great for us extra set for particularly messy play, so that the more costly custom-made garments don't get destroyed, and also a really cost-effective option if you're undecided about whether a donor site requires compression or not. So you can start with a ready-to-wear garment which may prove to be sufficient, or you may need to upgrade to custom, or you may be able to safely discard wearing compression. These paediatric ready-to-wear garments are available available in black or beige. Very simple to measure. We're basically taking circumferences of the chest, waist and the end of garment for the vest with 2 arm circumferences, the top of the arm and just above the elbow. For measuring for bike shorts, we are also measuring the waist, then the hips, top of the thigh and just above the knee. Now these lengths of the arm sleeves and the bike shorts can just be cut with scissors. They won't fray, so you can shorten them if that's required. And the waistbands of the bike shorts have also got adjustable tabs on the side, and if you feel like you need to open them a little bit wider than the little slit provides, you are able to cut that slit down a little bit further yourself. There's 8 sizes, and there is a range of sizes that are accommodated within the 8 sizes. So we think we've provided a very good range for to provide a ready-to-wear garment. And I mentioned the Omphalos form, but we do want to highlight that we have got new forms. We've simplified the ordering forms. We've taken out the detail that you don't need, that we don't need, so you don't have to be chasing that information. We've also updated all of the measuring forms. It's been a massive project, and there's a couple of further tweaks that we're making. It enables us to provide live updates of fabric colours and thread colours, what's available. It reflects changes that we've made in design options over the last few years. We've really tried to improve the usability and the function of the forms. They're all available as interactive PDFs. We've updated the contact information, which you'll all be very pleased to hear, because even though we moved the factory premises 2 years ago, unfortunately our forms still showed the old address, so it was tricky for some returns of garments. And we've also included a QR code on the forms that can take you direct to the website. So if you're in the clinic and you've got the form and you've got your phone, you can just go straight to the website to check any queries. And as I mentioned before, we've introduced a suite of specialty forms. So we've got a bariatric band form, we've got the Omphalos form, and we've got a custom bra cup form. As always, I would refer you to the Jobskin website for a huge range of resources under support and training that are updated regularly. Veronica and I are available to help you through telehealth or phone or email. Email's probably the most reliable way to reach each of us rather than phone. And of course, our awesome design team are available via email and via phone. Ordering exactly the same. Use the cover order form plus the relevant measuring form, and please, photos really help, particularly when you've got little idiosyncrasies. Those forms get emailed to customer.service@jobskin.com. Photos can be uploaded through the portal on the website, and of course the customer service is available for you by phone. Thank you for your time in watching this webinar. We're always open to ideas for things that you would really like to learn via webinars, so you're very welcome to contact us. Thank you again for your time. Bye then.